A neuro exam is difficult, both in real life and in PACES. In fact, neurology is a difficult specialty, unless of course you are a neurologist. Now, I'm not a neurologist and you're not a neurologist. Or wait, you could be a neurologist watching this video, in which case stop. Just joking. Feel free to add anything I might have missed, because we're all here to educate each other for the patient's benefit. Now, particularly daunting is doing a neuro exam out of hours or in an acute context. But here is a specific 3-step guide to help you. Number 1 is the history. Look for red flag neurological differentials. Firstly, motor neuron disease in the context of bulbar palsy. Secondly, myasthenia gravis crisis or flare. Thirdly, is a rapidly ascending motor weakness due to Guillain-Barré syndrome. Fourthly, is features of spinal cord compression. Fifthly, is an acute stroke such as a midbrain infarct. Secondly, is the examination. Look for red flag neurological signs. Firstly, is an impairment in the patient's speech, swallow or their breathing in the absence of any obvious respiratory cause. Secondly, is fasciculations with the speech, swallow, breathing or limb weakness associated with motor neuron disease. Look at the patient's tongue, their arms, their legs or their posterior trunk for any fasciculations. Thirdly, ptosis equals myasthenia until proven otherwise, particularly with complex ophthalmoplegia. The hallmark feature of myasthenia is fatigability, so check for fatigability of the upper limbs and upward eye gaze. Fourthly is a rapidly ascending motor weakness of the legs with absent ankle reflexes, suggestive of GBS. Fifthly is features of spinal cord compression. Now, the severity of motor weakness or sensory impairment doesn't always correlate to the severity of spinal cord compression. Specific signs are impaired proprioception. Ask the patient to close their eyes and move their big toe up and down. If the patient can't tell which is which, they've got impaired proprioception. Check for saddle paresthesia, impaired anal tone, and check sensory level. Thirdly is the management. If there's red flag neurological differentials or red flag neurological signs, then seek urgent help from a neurologist. Closely monitor the FVC and early escalation to respiratory high care or intensive care. Respiratory muscle weakness from a neurological condition can rapidly deteriorate. The patient may be fine, then on a couple of litres of oxygen, then be in respiratory failure needing organ support. So beware. And thirdly, if they've got spinal cord compression, then get an urgent MRI spine, vetted by a radiologist, inform the spinal surgeons to be on standby. I hope you found this helpful, so keep practicing, be as specific as possible, and don't forget to subscribe.